Hello and welcome to another episode of the Parks Trust and Open University podcast. We're excited to welcome back Dr. Jitka Vseteckova, a senior lecturer in health and social care from the Open University, and Dr. Abby Methley, who's a senior clinical psychologist from North Staffordshire Combined Healthcare NHS Trust. I'm Ellie Broad from the Parks Trust, and today's topic is walking and talking therapy. The last year has been a challenge for everyone, and for many people it has brought about feelings of anxiety and uncertainty. This year, accessing face-to-face counselling has been more difficult than usual, which has been particularly challenging when this is a time when people might need it the most. However, many people have been finding a different kind of therapy very valuable, and this is walking therapy. Today, we're going to explore the benefits of this approach and how it can help everyone, particularly older people. So let's see how walking can benefit us. Jitka, can you tell us more?
Thank you, Ellie. Good morning. So there are two things when we think of walking and outdoors, and both, of course, immensely beneficial for our physical as well as mental health and well-being. So walking is a fantastic type of exercise. We can pace it according to how we feel at the moment when we're walking. We can slow down and speed up depending on how we feel at the minute. And we are in control of what intensity we choose, and in this way we can make sure that we don't overdo it. Walking prompts us also to breathe regularly, which means that we're getting a regular supply of oxygen into our blood. Walking is great because the blood circulates regularly, and that means that our body and brain and all organs are actually getting a regular supply of blood that carries nutrients, oxygen, and of course glucose. So this is helping us to perform optimally, and it is very much helping our brain because brain is the most sensitive organ to any lack of oxygen or glucose in our bloodstream. So when we get a regular supply of this, it really supports its optimal functioning. It is also an exercise. When we're talking about walking, walking is also an exercise. So we're definitely getting a workout. Our muscles are working, they're strengthening, and it's also speeding up slightly our metabolic rate that, as we know, decreases naturally with aging. This means that all organs are working on a more optimal level compared to when we are sedentary. And this is great because the faster our metabolic rate is, the faster our body gets rid of all the metabolic waste products that our body creates. Some of the waste products can be also residues from the medication some of us need to take every day or on regular basis. And if the residue is not cleared up out of body and it builds up, it prompts or it can prompt severe drug effect or side effects of the medication we're taking. So preventing it speeding up metabolism is also preventing a toxic buildup that then might be toxic to our brain and other organs. So walking exercise is a fantastic exercise, and especially if we can do this outdoors. Sometimes we might be feeling a little low and thinking that I'm not going anywhere today, and as with the weather that we never really know what it's going to be like, we might be feeling a little bit on the low side, a bit easier. It's easier in general to go out when the sun is shining and all is bright. But even if it's raining, if it's cold, if it's windy and we're not feeling up to it, even if we go out just for 5 minutes, we made a huge step because it's usually the most difficult thing to get out of the doors. So once we're out, we will realize that probably 5 minutes will turn easily into 10 or 15, and we will start feeling better. We will start feeling the difference. Our brain will get nicely oxygenated and we will feel refreshed. We may even notice that our mood improves and we feel better overall. So another huge advantage about being outdoors and walking outdoors is that the changing weather and temperatures and weather conditions strengthen our immune system. And I can't wait from Abby to hear more about how the actual therapy works.
Great, thank you, Jitka. So it's long been known that beautiful green outdoor spaces have a lot of potential to support both physical and mental recovery and healing. And this is typically why rehabilitation hospitals were often built in the countryside. So studies show that green spaces promote mental well-being and increase quality of life for people with mental health needs. And the recommendation is that everyone completes a minimum of 120 minutes a week out in nature to really maximise their well-being. And there are a broad range of mental health interventions that can take place in nature. And these range from mindfulness and yoga all the way through to the more adventurous types of wilderness therapy and more extreme sports. And an area that's been of particular interest during COVID-19 is providing traditional talking therapy, but in an outdoor setting. And this combines the benefits of conventional indoor therapy with the benefits of connecting with the natural world and the benefits of gentle exercise, such as lowering blood pressure and reducing stress. And in addition to decreasing the COVID-19 transmission risk through improved ventilation and social distancing, there are many other benefits to this way of working. So these include less of a sense of formality because you don't need to make eye contact and you're not in an office environment. And this increases access to therapy for people who wouldn't typically have felt comfortable in traditional services. It's less anxiety provoking for people who find formal services intimidating. And it's just a more connected human experience with a really great sense of freedom from being outside. Outdoor therapy in COVID has been very beneficial for people who struggle to access technology, or for people who don't have a private space at home to discuss difficult issues in confidence, or who struggle with communicating due to physical or psychological reasons. So it could be actually speaking, or it could be due to anxiety. And outdoor therapy brings a really different angle to our work. So you can draw on the experiences of being in nature to complement the therapy process, such as using the changing weather to mirror experiences of changing times, for example, when people are grieving or they're in recovery from low mood or anxiety. You can also use the sensory aspects to develop skills in breathing exercises and mindfulness. And to support people through difficult times, we often use the metaphor that we are the sky and our emotions are the weather. The weather changes constantly, but we remain throughout. And there's something about being outdoors that really brings these messages home in a really different way to working from an office. Now, there are obviously considerations about the appropriateness of outdoor therapy, and the British Psychological Society have published guidance on this. So people must feel comfortable in the chosen space. The intensity of exercise must be planned and agreed in advance. And there have to be considerations about the terrain, mobility, and how you're inevitably going to manage the bad British weather. There'll also need to be a plan to maintain confidentiality and to agree what should happen if someone becomes upset. But both studies before COVID and the experience of many therapists during COVID suggest that all these factors are manageable with discussion and prior agreement. So for anyone who's interested in learning a bit more, outdoor therapy is not provided as standard on the NHS yet, but there are discussions within services about how to make this more commonplace, so it's always worth asking. If people are interested in completing this with a therapist in private practice, then I recommend finding a therapist through the usual accredited route. So this includes the Healthcare Professions Council, the British Association for Behavioural and Cognitive Psychotherapies, the BABCP, and the British Association for Counselling and Psychotherapy, all of which have registers where you can search for a qualified therapist. And this ensures the person you're seeing is properly qualified, and you can then have discussions about whether they offer an outdoor option. For anyone who's interested in the research, I really recommend following the link to a review of studies on this topic by Dr. Sam Cooley in 2020, where he identified 38 articles on talking therapy in nature-based settings. And Jitka and I are also contributing to this literature by reviewing the available outdoor therapy interventions for older adults who've experienced traumatic events. And we hope to be able to provide an update on this exciting area soon. Whilst it's recommended that you seek professional support for serious mental health difficulties, you obviously don't need to be seeing a therapist to access the benefits of walking and talking. And this can be very beneficial with a friend or a family member.
Yeah, that's very true. Thank you, Abby and Jitka. That's very true here in Milton Keynes, especially because there's loads of free green spaces you can visit where you can do your own walking and talking therapy with a friend or a family member. Parks Trust here in Milton Keynes, we manage over 6,000 acres of parkland across the city, and most housing estates also have a park very close by. The parks offer a huge variety of landscapes and wildlife, which can help distract even the busiest of minds. We offer a wide programme of guided walks suited to all abilities, as well as other activities out in the parkland. We're even running our first season of forest bathing sessions soon, which are relaxing walks that offer a form of meditation in nature. But there are tons of other activities you could do on your own or with friends. Just check out our website. Outside of Milton Keynes, many other local councils offer health walks, and you may even have a local green gym where you can do outdoor volunteering with other people. Or even now the weather is better, why not meet up with a friend and take a socially distanced walk in a new park and try your own walking and talking? For more information about the parks in Milton Keynes, you can visit our website at www.theparkstrust.com.